Already you had tea, no? Okay. Gopi is watching from home. He can order directly from the kitchen. His younger sister can bring a nice cup of tea. So online students, we'll give a break. I think. Yeah. Vizag is saying we are punching some answers. Please make it interactive by honoring our objections also. We will honor your objections also. But we'll have a proper fighting round. Right? Be ready with the number, question number where you want to fight. We will fully make it two-way interactive session. Absolutely no issue. Time-dependent prolonged post-antibiotic effect. Where do you see? Another very classical question about clindamycin. This was asked previously lot of times. So which drugs carry post-antibiotic effect, doctor? So that you don't need to give 2 times, 3 times dosage. 1 time de do per day, it will have post-antibiotic effect. Aminoglycosides, fluoroquinolones, tetracyclines, clindamycins, rifampicin, rifabutin. They are the classical drugs which are having a post-antibiotic effect is what you need to remember. Right? Right. Now doctor, vancomycin resistant staph aureus, visa, vancomycin insensitive also it is called, staphylococcus aureus. Linezolid is the one which is specially used for the purpose of treating the DRSA. Paclitaxel, there are only very few which do not lead to myelosuppression among antineoplastics. Most of them will lead to myelosuppression, even paclitaxel also. But paclitaxel is derived from E. coli, it can lead to alopecia, and it is used in breast and lung cancers. They are all the true statements about paclitaxel. Proton pump inhibitors, long term, what are the complications which will occur? Proton pump inhibitors. Do people take it frequently? What is the most common reason people don't drink alcohol? No sir, I am a complete teetotaler, I don't drink. If he says generally, one reason is he is really a good guy. Second is he has got lot of reflux, so that already this is causing enough drama, he is afraid of drinking. Don't think all people who don't drink are all good people. Oh no, don't think. But there are a third variety of people. अच्छा, 2 pegs मारेंगे, कोई बात नहीं. अच्छा, Pantocid मंगाओ. So they take Pantocid and then start blue label Scotch whiskey. The third variety. So long term अगर Pantocid ले लिया, then what will happen? It will decrease the acidity of the stomach. That's the reason there is a great chance of Clostridium difficile enterocolitis. They also found association between calcium absorption and the development and usage. So calcium malabsorption, osteoporosis, and community acquired pneumonia. These 3 are well documented in lot of studies basically. Okay, doc. Hepatitis B, you don't use zidovudine, but you will use lamivudine. One question definitely on ribavirin, how will you use? Interferon, when will you use? What is Pugh chain score? Hepatitis B and C, pakka. You have to read everything, anything about it. What is the fatal dose of lithium? Beyond anybody's ability. Sorry, lithium. Lithium is fine. You are supposed to know lithium, digoxin, tricyclic antidepressants, everything, anything. So what is your answer, doctor? About 20 tablets of lithium are about 6 grams. 6 grams is considered to be the toxic dose. There is a question about arsenic toxic dose. That is cruel. And that too you, in spite of taking all our mock tests, our mock test purpose is to tell this kind of simple things. Right? When to guess, when to not guess, when to miss. That's important. So, in spite of attending mock tests, if you are lured by impossible questions, you are trying to ascend onto the top of a horse, uncontrollable horse, you lose marks. You should not in a negative exam, negative scoring exam. Regarding NSAIDS, you cannot use in neuropathic pain. Neuropathic pain में diabetes and all those conditions, what will you give? Gabapentin, gabapentin. So we use more in musculoskeletal pain. Right, doctor? Rituximab, I told them one monoclonal antibody, जरूर पूछेगा. Abciximab, rituximab, adalimumab, so many apps are there. Commonly AIIMS का favorite question was which is chimeric, which is human, all those things. So rituximab basically is chimeric anti-CD20. It is used in indolent lymphomas and half-life and pharmacokinetics are dose dependent. They are all true. But what is the most common side effect, doctor? Most common side effect is chills and rigors. Is what you have to basically remember, fever and chills, just like interferon administration. If you take the infusion related reaction, it is a rare reaction, not a common reaction. Simple, what is common, what is rare? Based on adjectives, examiner wanted to check how well you read the Tripathi. Advanced prostatic carcinoma, what will you use, doctor? Goserelin is the one which is basically, this is a straight repeat from the previous AIIMS question bank. Dexmedetomidine is what? It is basically a centrally acting alpha 2 agonistic drug. So autonomic nervous system pharmacology, one question will come, one why, you will see 2-3 questions. Top 20 topics in pharmacology in the list given to you. Abatacept, where will you use, doctor? Typically in the rheumatoid arthritis. Okay. Then Pseudomonas. What are the classical anti-pseudomonal drugs? Piperacillin, tazobactam. We use day in and day out in the clinical practice. Oh, doctor. Cholinomimetics, anticholinergics. What is their chemical structure is the favorite question. Autonomic nervous system pharmacology. One more question. ये सब देखने के बाद फिर भी आप ऑटोनॉमिक नर्वस सिस्टम रिवाइज नहीं करके फार्माकोलॉजी अगर ऑल इंडिया पीजी को गए तो अफसोस की बात है. You should not. Now, basically there is a list of there. Glycopyrrolate basically belongs to quaternary amine, not a tertiary. That's the point. And you have got atropine, oxybutynin, hyoscine, they're all scopolamine, they're all basically tertiary amines. What are the drugs that lead to edema? Amlodipine, estrogen, cyclosporins, anabolic steroids, progestins, calcium channel blockers, they all lead to peripheral edema. Where is facial colliculus? This is also very easy question, repeatedly asked question. Typically, facial colliculus will be very close to, it will take a circuitous route around abducens nerve, is what you have to basically remember. Sphincter urethrae, I don't know what was the fourth option. It attaches to the bladder neck. Then that should be the wrong answer. Remaining 3 are all true. It is supplied by pudendal nerve, external urethral sphincter, and it originates from ischiopubic ramus and it is voluntary. All the 3 are the true statements. Dense regular connective tissue. ये कुछ पढ़ के आंसर करने वाला क्वेश्चन है क्या? कॉमन सेंस एमबीबीएस में क्या देखा सुना? Of course, if you don't know what is tendon and what is ligament, in spite of finishing housemanship, no problem. Still you will get seat. अभी शुरू कर सकते. Bone insertion is tendon. So, doctor, periosteum is not involved, but aponeurosis, ligament and tendon is what you need to basically remember. Shruti is proposing the other option is bladder neck. Yeah, we got that. Then, yeah. Shailaja is saying Edmodo topic list. Yeah, we will publish it on newsformedico.com, which is our new buzzing mantra. We wanted to promote it in a big way to make it the most easily available, freely available online resource for the preparation. You can also write articles, MCQs, original MCQs, submit it. and we will pay for that, let me honestly tell you. You can be the blog writers, so that we will come up with some professional articles. Now, membrana tectoria, this is beyond Vedantic question in anatomy, right? So, posterior longitudinal ligament, doctor, answer should be A, not B, just a small correction, typography. Posterior longitudinal ligament का extension होता है वो, right? Prolongation of the posterior longitudinal ligament will be the membrana tectoria. Now, a foramen oval picture was given. What are the components passing through that? So, what do you expect in the APPG entrance? Foramen spinosum will be shown, and what will be passing. So, what can examiner at most can show now? Few X-rays, few ECGs, few histopathologists, or few dermatology pictures. But he will also give lot of complete striptease case story. वो केस स्टोरी से ही पिक्चर नहीं देख के भी बोल सकते हैं आप, provided you know what is the high yield topic list expected. Oh, that because examiner can only ask from that. So, doctor, maxillary nerve doesn't pass. It passes through rotundum, Rotamax pen. Rotundum is maxillary. Is what you need to basically remember. Ovale is male, M for mandibular, A for accessory meningeal, L for lesser pituitary, E for emissary, MALE is ovale, male is ovale. Now, Turkish saddle, general knowledge question, Sella turcica is pituitary gland. You will definitely answer. इसलिए पूरा पढ़ के नहीं जाना. 20-30 questions. If you fill all your brain with information, you can't guess in exam hall. Then that will lead to problems. Then paniculus adiposus आपके हाथ में नहीं है. इसको आंसर करना भगवान के हाथ में है. Because this is some rare point on the last smallest print in Gray's Anatomy. Okay, and we in modern time, Gray's Anatomy means we only know one TV serial. We don't know that it is an anatomy textbook in the modern time. So, right, doctor. Paniculus adiposus is a fatty layer of the subcutaneous tissue, and it is superficial to some deeper vestigial layer of muscle, which is typically seen in places like scrotum, is what you need to basically remember. Harikiri. Actually, this is very close to Telangana. What is there? Kirkiri. That is the next expected question in our Telangana PG entrance. So, Kirkiri is a self-inflicted injury. By whom, on whom? So, Harikiri क्या होता है? Harikiri होता है जापान में samurais are there, no? They are the fighters. They are supposed to maintain some not only fighting skills, but some ethical standards. But one day one samurai found somebody very good, he proposed, she ignored, and he has hijacked her because he is a samurai. Then the king will call him, samurai, you have done the mistake. So he can't kill samurai, because if he kills samurai, he has no bodyguard. King will be killed now. So what he will do? Get a topaz blade, will say the Japanese king. He will put one small self-inflicted injury on the abdomen of the samurai. Chalo, aapka punishment ho gaya. Now once more you are a pure samurai. So that is called self-inflicted injuries done by the samurais on their abdomen is called as kirikiri. Sorry, harikiri is what you need to basically. It is also called seppuku in the Japanese language. If you didn't answer this, don't worry. You are not a librarian, no. You are a medical student. How will you know all these things? Is it any old question? Even if it is old also, there are some old questions which will never come, let me tell you. They are buried forever. Right? If at all they are asked, they will be asked only in the same entrance but not in any other entrance. This is not, don't worry about it. But AIIMS में one question on different tortures. If pharynges के ऊपर beat करे तो उसको क्या होता, phelagna क्या होता. One question on torturing methods will be asked. If ice bags are tied and thrown into sea, what is it called as? So that is all. One question will be there, fantasy question. So what is meant by para-suicide? Ladies hostel के सामने खड़े होके चिल्लाते हुए मैं मर रहा हूं तेरे लिए, and then you cut and then you will ask your friend immediately, did you bring Dettol, everything? All your friends will be holding all that. So what you do, which is not a suicide, less than a suicide, is called para-suicide. Commonly para-suicide is done on wrist cutting. And para-suicidal behavior is also a feature of which personality disorder? Borderline personality disorder is what you need to remember. One ossification center will be there, doctor. Which year, which ossification center? अगर वो नहीं है तो which is other irritating question in forensic? Dental eruption. You prepared for molar eruption, examiner will ask canine eruption. You prepared in the lower jaw canine, he will ask upper jaw canine. किस्मत अच्छा नहीं है तो आपका दांत, आपका फेवरेट दांत नहीं आएगा. तो be very sure. Typically, when will you check for? Elbow, wrist, shoulder, iliac crest, ischial tuberosity are the favorite 5 questions, doctor. Female में कब fusion होता, male में कब fusion होता, I leave the literature for you. You have to remember one question going to repeat in the next forthcoming exam. If a patient consumes homicidal poison, comes to you as a doctor, if you don't report about the medical legal case to the police, you will be put under jail. Under which section? 39. If you didn't answer also, don't worry. There are so many sections in law. But for those 1-2 crimes you personally did, how will you remember everything? Very difficult. So, last before year paper mein 4 or 5 sections were asked. That is too much. So, what is the fatal dose of arson? I think more than 2 marks in forensic. Out of 6 or 7 questions asked, remaining are unachievable. It is 70 to 200 grams, milligrams. Maybe somewhere nearer figure was given. I may not be very approximate. I am actually approximate. Now, young lady came with subperiosteal resorption of the 2nd and 3rd phalanges. Only one diagnosis comes to your mind, that would be hyperparathyroidism is what need to be remembered. Acute head injury ho gaya. Is it contrast or non-contrast? Non-contrast CT is what you will basically use. Now, doctor, yes, Saurabh from Punjab is saying it is 120 to 200 was given. Is it? Yeah. 70-year-old refused to take influenza, developed death post-influenza pneumonia. What is the most common cause? Is it strepto or staphylo? What do you agree with? Strep was not there in the option. If it is not there in the option, staphylococcus. But strep is in the option. Image was there. Measles was also there. Oh, measles in a 70-year-old is too far away. CMV is too much. Legionella could be. Right? So, I think strep is not there. But if strep is there, that is more common. Second comes the Staph aureus. That's what you need to basically remember. What will MSc 1 and 2 will do? This is a straight repeat from the last year November AIIMS. It typically present the antigen to the T cell. That's what it will basically do. Then untypable Haemophilus influenzae, what will it lead to? It lead to otitis media, it lead to sinusitis. Easy to guess. But it lead to puerperal sepsis. Generally puerperal sepsis means we will only remember group B streptococci. Even we should remember untypable H influenzae, but meningitis is caused by typable H influenzae. That's the reason we use vaccine against the typable H influenzae is what you need to remember. But doctor, if you take microbiology high yield topic list, highest number of questions were asked on streptococci. Then H influenza, HIV, hepatitis B, like that if you go in the descending order. So accordingly examiner also is sticking to that same plan. Raised ICT, hypertension, bradycardia, classical of Cushing's. One question on sleep EEG, doctor. Definitely will be asked in exam. Where will be somnambulism, where will be bedwetting, which phase mein hota, everything. So scenario stage 2, where do you typically come across? Last week in Sunday mock test we had, no? If a person happened to wake up, what happens, which waves in EEG? I will keep asking all these high yield questions in the mock test, at least after taking that mock test and this AIIMS and answering both the locations wrong. Still you did not prepare for EEG and sleep, means we are failing in our job. Single ion channel current measurement, how will you do it, doctor? Basically, we use a patch clamp. So what is patch clamp recording? I will leave the literature for you. You can review that. But this is something which you can't achieve. Put a guesswork wala question. Don't worry about it if you answered wrong. Counter current mechanism. What are the highest number of questions in physiology? List of topics I gave you. Nephron physiology. Proximal connective tubule, distal connective tubule, tubular secretion, in collecting duct, everything you must read. So you have loop of Henle, vasa recta, which will basically participate in the counter current mechanism is what need to be basically remembered. Counter current multiplier otherwise, if not mechanism, whatever. Now doctor, oh, this is a beautiful question. Deep patellar tendon reflex. Which type of reflex होता है वो? Stretch reflex होता है. So what is a very common high yield topic? Extrafusal, intrafusal fibers, muscle spindles, Golgi tendon organs. 1A afferents, 2 afferents. That entire 2 pages of Genon you have to read, doctor. Now anyway, what are extrafusal fibers? In every muscle, whenever we do dissection, we see the fibers, muscle fibers, they are extrafusal. What exactly is contracting is extrafusal. How much is that contraction happening? How much tension generating to sense that some muscle fibers are adopted? They are called intrafusal fibers. Once more, among the intrafusal fibers, some of them are basically muscle spindles, which are in the center of the muscle. Some are towards the point where tendons are located, called Golgi tendon organs. Accordingly, there is a big story. Intrafusal fibers may, what are the subtypes which are there, which will sense the muscle stretch, which will sense the tension. I leave the literature for you. So ultimate answer is what? Dynamic intrafusal fibers are the ones, the moment you tap on the patella and it gets stretched immediately, muscle contraction. The muscle contracts because of what? The moment you have tapped on the patellar tendon, it got stretched. That will cause dynamic intrafusal fibers to activate. They will go to the alpha motor neuron, which is located in the spinal cord. That immediately will cause the quadriceps to contract. So that is how the patellar tendon reflex will basically occur. Now doctor, one question on nerve endings is a favorite question of the examiner. But liver also was there? I doubt. Because liver capsule also can sense the noxious stimuli, not only mesentery. Okay. So that is one important thing. If you look at the nerve endings, mesentery, pancreas, capsule of the liver, they all have sensors available for sensing the noxious stimuli. See, it does not mean that the same question will come in the next entrance exam. But what is the point you need to remember? Sensory receptors, Pacinian corpuscles, Meissner's corpuscles, free nerve endings, where are they located? What is their function? Definitely one question comes on sensory receptors. In the high yield topic list in physiology I gave to you. Oh, this is the easiest question on the world. Posterior columns kya nahi karega? Pain is carried by spinothalamic tract. I think examiner doesn't know. You have expertized what is pyramidal tract, extra pyramidal tract, what is pseudo bulbar palsy. अब तो एडवांस लेवल बोल के एग्जामिनर को मालूम नहीं है. Pain is carried by spinothalamic tract. Oh, doctor. Limbic system is a very high yield topic in entrance. Pepet circuit and limbic system. Hippocampal formation को continuously stimulate करे तो what will basically happen? Long term potentiation will happen. What is the need for doing revisions before entrance? जरा hippocampal area को what all that you read across the year you will be stimulating it, redo, and then you need to go to the exam, right? So that is the idea. So first time when you drive car, no, or a bike or a bicycle, you will be thinking what your left hand doing, right hand doing, what you are doing behind everything. Slowly you will forget your what is behind in hands, and only you will be watching the road. After that you will forget also the road. You will only be thinking about destination, right? What is that called? It is called synaptic plasticity. Why? Whenever you are repeatedly doing, that is causing continuous hippocampal formation stimulation, which is causing long-term potentiation. Right, doctor? Even if you are a surgeon, if you start a hospital, you are a very good surgeon, doctor. Laparoscopy means only you. Even a small seed in the mesenteric underneath, you can pick it up through laparoscope. But when you became popular, you started a hospital. Big nursing home. Nursing home शुरू करें तो सुबह से शाम तक क्या होता? How much money came? How many patients came? How much you have to pay to oxygen fellow and your nurse and ward boy, everything. Ultimately one day, and because under you people are working. Actually you learn more when other people work for you rather than you only work. You will work initially for money. After that money starts working for you. So you will lose that ability to do if you are not doing skill set. Okay, doctor? So long term potentiation.